have him with us. He has been with Novant for about 3 months now, is that correct? And his topic today is staying young at heart and young in the hips, how we can defeat hip arthritis together. And so I'm going to go ahead and let him get started. If you will, please mute your microphone so that we're not causing any distractions or disruptions while he's speaking. And at the very end, if you'll jot down during the Zoom meeting, if you'll just jot down any questions that you may have, and we can ask at the end of his talk. And again, we thank you so much for joining in with us. All right.
So I'm going to take my mask off so you can hopefully see me enunciate a little better. And I'll be missing out on getting to know each of you guys in person, but I look forward to that day where I can meet you in person. Oftentimes I really feed off of interaction, so bear with me. I'm going to do my best to be as animated as I can and keep your attention, even if it feels kind of lopsided like I'm talking to my computer screen. So, and I hope you don't think that you're talking or listening to Doogie Howser present here. I know that most often I get comments that I can't possibly be done with school yet, since I look like most patients' grandchild, but I'll take that as a compliment. So it's great to be with you guys today. So we're going to be talking about hip arthritis, and my main goal, and Dr. Azar, Dr. Potter, Dr. Ray, all of our combined goals at Novant Ortho is to get you looking like this guy here. And so by our talk today, we're going to talk about the importance of hip arthritis, the causes, what it feels like, so the symptoms, other conditions that can kind of masquerade and that we have to ask you questions to make sure other things aren't present that can cause symptoms that look like arthritis, importance of exercise, and other types of treatments to get you better. So first of all, why is it important? So approximately 1 to 10% of the population has hip osteoarthritis, and that's within the United States. So, that's a substantial chunk of the pie when you look at a tenth of a circle being afflicted with a degenerative joint disease. In 2011, over 28 million people in the U.S. had osteoarthritis. And then by the age of 85, best estimates are that 1 in 4, 25% of patients will develop painful hip osteoarthritis. So a high burden of disease in our country. So what exactly causes it? So we're going to have a little anatomy lesson, and I'm going to give you just some brief course in physics. So if you look here at the pelvis bone, our spine sits in a bowl through the sacrum that transmits force from the bowl of the pelvis down to the femur, which is the thigh bone. And our hip joint is how that force transmits and is able to propel us forward when we walk, run, and squat, and all kinds of stuff. So you might imagine that your weight has a big effect on the forces that transmit across that joint. And so certain conditions like obesity, that being a body mass index greater than 30, and you might hear about some different numbers when you visit your doctor, some things we'll talk about, have a substantial effect on the forces and the progression of arthritis and the wear and tear of cartilage and meniscal and labral tissue that live in the hip. So first of all, the hip is one of the body's largest joints when you look at the sheer volume of the joint space. It's truly a ball and socket joint. So, we talk about different ball and socket joints, and another one we commonly mention and lump in this category is your shoulder, but that's truly not a ball and socket joint. That's more of a golf ball on a golf tee. And that owes in your hip to the stability that's added by the bone volume. So you have more of a cup formed here, and we call that cup the acetabulum, which in Latin literally means vinegar cup. So the ball sits inside of that, and within this blue structure here, that's the cartilage. We call it hyaline cartilage, and it's on the end of the ball, and it helps. It's almost like a sponge, and every time you put weight down on it, it squeezes the water out of it, the water content of the joint fluid, and every time you ease off of it, it reabsorbs the water. So a very beautiful design that our hips and essentially all joints in our body have through cartilage. And then there is a other type of cartilage called fibrocartilage that forms the labrum, which is just a little shoulder of cartilage here. Now, the reason I bring that up is sometimes you can get tears in that labrum and it can hurt because you have nerve endings in it. And when you have arthritis in the joint, you can tear the labrum and it can hurt, pop, click, all kinds of stuff. Now, the last piece of our anatomy lesson comes in what we call subchondral bone, which just means sub meaning underneath, and then the bone lying underneath the cartilage. In arthritis, what happens is the cartilage wears and frays, so a structure that's normally very lubricated and smooth so that it glides past one another is frayed and rough. Then the joint space narrows because the amount of sponge or cartilage is smaller than what it used to be. And progressively over time, you may even erode all of the cartilage away and you're left with bone on bone. Now we see that on x-ray. So, you know, commonly when you come see us, we're going to get pictures of your hip, and that tells us what the space between your bone structure is, because on x-ray we see bones, right? We do see a couple of other things like fat and soft tissue, but primarily what we look at is your bone and the space between the bones, because that tells us how much cartilage you have left. And then over time, the lining of the bone has nerve endings in it. So just like we talked about a second ago, that subchondral bone that lives underneath the cartilage has nerve endings in it. And when you chew through all the cartilage and you're left with bone pieces sticking out, your nerves go crazy and it hurts. And then last but not least, in addition to the pain, you can get stiffness. And the reason there is you can sometimes get bone spurs and you get decreased gliding of the joint because of the lack of smooth cartilage. Another predisposing condition can be increasing age. It just comes with the natural wear and tear of repeated motion over time. Occupational demands in the past. So if you had a long history of lifting or certain athletic prior athletes can certainly have arthritic changes in the hip. And sometimes we don't see any other meaning or reason for them having the wear and tear, and we just call that idiopathic, meaning there's no other reason we see, but it's there. And so this is just an illustration. This is before and this is after. So that's just kind of an illustration of what happens as our cartilage destroys and tears and roughens, and then the bones, along with their nerve endings, get very irritated and it hurts and you get stiff. So what symptoms can you feel? Just like we talked about, pain, stiffness, that can develop into a painful gait or a limp, and you can get locking or popping or clicking in the joint area. So just to clarify with the pain, this can develop slowly over time, so over the course of years or months, but sometimes it may be pretty quick in the onset. It may be as a result of an injury or what we call an inciting event, so a misstep or a jarred step sometimes can really kind of recruit inflammation into the joint and it spins you off the deep end of pain. Sometimes it can be worse in the morning after you've rested and laid all night. And that allows, there's a principle called gelling. In terms of the actual process of what happens, it's not like your joint fluid is turning to gel by any means, but the roughness of your cartilage, when you first start to move it in the morning, can feel almost like you have a thicker kind of gel inside, and it doesn't feel so good because it's stiff. So another chief thing that helps us to figure out if your pain is coming from the hip joint or hip arthritis is the location. And that can be primarily in the groin area is where your hip joint locates. we call it the C sign. And when a patient takes their hand and puts it over their hip and says it hurts right here, and you make a C out of your hand and put it on the outside of your hip, that is a higher indication that it's coming from inside the hip joint. Doesn't always mean that's the case, but certainly can be, raises our suspicion. It can also radiate through your buttocks or around the highest part of your thigh, your inner thigh. And sometimes, we see this in kids a lot too. Hip pain can radiate all the way down to your knee. And so, we certainly think about causes of hip pain and the reality of hip pain, even if you're complaining of knee pain. So it's not that we don't believe you, we're just trying to be careful and make sure we got the right joint. Sometimes it can be dull and achy in terms of the quality of the pain, and then sharp stabbing at other times. And then certainly with the changes in humidity and the changes in barometric pressure, people will say that the number one indicator they get of their arthritis being there is weather changes, whether rain's coming, whether that's a blessing or a curse, I'm not sure, but so you can also get stiffness in your hip and low back and upper leg, and primarily where that comes in is I want to draw your attention to thinking about the hip joint as not just a ball and socket, but you have all these muscles and ligaments and tendons that are attached to that joint. So when you have the underlying ball and socket that are irritated, then all the muscles and tendons around can get stressed and overused in certain new ways that they're not used to. And that primarily comes from you walking different because you're trying to avoid pain. So when you walk different, you're using different muscles. And sometimes you use muscles that aren't designed and aren't meant to carry the brunt force of your weight. And so over time, you can not only have hip arthritis, but you have muscle strain, tendonitis, and all kind of other things. So, and that's where the locking, popping, and clicking can come in from, either from the labrum, which is that cartilage, or it can come from actual muscles or tendons popping over the bone. Okay, so other important causes for us to remember as physicians and as patients, what I want you to keep an eye out for is if you start having a lot of back pain, then that may be an indication that even though you do have pain in your hip, if it connects into your back, you can have arthritis in your spine that squishes on your nerves. And that's just, in a fancy term, can be disc herniation, which just means the outpouching of the disc, or stenosis, which just means narrowing because you have so much new bone through a bone spur and it squishes on the nerve. That can certainly refer pain from your back to your hip when in all reality your hip looks great. So that's certainly important to keep in mind. You can also have a hernia in the inguinal area, which is just on the front lower part of your abdomen. If you have a hernia there, sometimes that can refer pain into the groin and confuse us. So that's why we'll ask you if you have any bulging, and then if there's any quality of pulsatile pain, meaning you can feel your heartbeat in it all the time. Certainly things like an abdominal aneurysm, which is just where the aorta can get a balloon outpouching of itself, can cause hip pain too. Now, other musculoskeletal causes of hip pain can be a fracture. So if you have a fall or you have known osteoporosis and you fall or you misstep, just a few weeks ago, I had a patient who didn't even really fall. She just bumped against the wall, but she had severe osteoporosis, and even just bumping the wall, she fractured her hip. So that's a rarity. I wouldn't say that that's common, even among females as we get older, but certainly important to keep in mind. And then a tumor, again, I don't want you to be worried if you get hip pain, but I just don't want you to go on forever at home if you got hip pain. Let us come help you and take some x-rays to figure out if you have any mass or tumor in your bone. And then the last thing would be you can get a joint infection, and with that you would have fevers, chills, red skin, intense pain that kind of starts all of a sudden. And if you get fevers with any type of joint pain that seems to be connected, please give us a call so we can just investigate that and check that out. Greater trochanteric bursitis is just when you get pain on the outside of the hip, and the muscles pull over the bone and irritate the area, and we can put some medicine in that and calm it down. So reasons to call us, like I mentioned before, certainly if you have a fever, that'd be important for you to call us. If you have weight loss that you're not meaning to lose weight, so we call unintentional weight loss, or red skin, by all means, give us a call. If you fall and you're unable to walk after you fall, that's certainly concerning that you might have a fracture or some kind of pulled muscle or something like that. You can have, again, the pulsatile quality to the pain. You can have a bulge in your groin. Especially give us a call very, very quickly if you have a bulge and you can't pass gas or pass stool. So that's a sign that we might need to talk to the general surgeon about a hernia too. We get an ultrasound to figure that out. And then in men, if they have testicular pain or changes with urination, and also in women, if there's any changes with urination, always good to let us know about that. So what can we do to treat hip osteoarthritis? So this is kind of the meat and potatoes of our talk that we'll get through quickly. Thankfully, it's very simple. First of all, I want you to stay active. There's really good evidence that benefit exists for land-based exercise compared to water-based exercise. So that being walking around, an elliptical at the gym, compared to just swimming in a pool. But aqua therapy is also an important and effective means for patients who can't walk on the ground. Okay, so if you come in and say, I just can't do it, I can't keep walking, I can't get on a bike, I can't get on a treadmill, then by all means, aqua therapy is great. To get, like we talked about, the amount of force going across your joint down by losing weight and taking weight off of that abdominal area, off the chest area, off the arms, can certainly improve the amount of force across your hip. As a side note here, for every pound above your hip, you multiply it times 6 to get the force on your hip joint. So you can imagine that's a really good investment. If you can take off a few pounds above, you get over 6 times that returned in your investment. A new really great resource we have here at Novant Health is Core Life, and they're essentially a clinic with a doctor, and they also have a gym and therapist that can help you get connected to do a very specialized and you specific goal and exercise program to try and help you lose weight or just maintain your fitness. So first of all, stay active. Second of all, like we talked about, if a patient's overweight or obese, then we certainly focus on the benefits of weight loss because it's a low risk measure. And when you look at risk and complications after the OR or having a surgery, it's certainly much higher in patients who are overweight and obese. So next, Tylenol, 1,000 milligrams by mouth, roughly every 8 hours. So Tylenol is a very safe medication, and I feel confident saying as long as you don't have liver disease, then it should be fine for you to take that starting out. And I would recommend doing maybe a course of a week or 2 weeks of that regularly, whether you have pain or not, because there's an anti-inflammatory effect that occurs even with Tylenol. So Tylenol, 1,000 milligrams every 8 hours. Now you can consider NSAIDs, which is a non-steroidal anti-inflammatory drug. Things like naproxen or ibuprofen, Motrin, all of those fit in that category. I'm not going to go over doses here, but I want you to be careful with this medicine, especially if you have known kidney disease, problems with reflux or bleeding in your stomach or in your stool, or if you have known heart problems or you take anticoagulants. Best to stay away from that one until you see your doctor and talk about it. For most people, it's okay to do a limited course, maybe a couple of weeks, again, like we talked about. But to be on this medicine and use it as your permanent crutch can be dangerous too, because even healthy patients that take this for a long, 3, 6, 9 months to a year, we even can see changes in your renal function at that point. So being careful with that and just checking in with us if you have any questions about that. the last couple of points here. So we can do a steroid injection in your hip, and we can use ultrasound to guide the needle and avoid any blood vessels or nerves that might be nearby, and put the medicine directly in the hip. And I can literally see the medicine go in your hip joint. So there's a nice balance of avoiding bad things and also confirming that we put the medicine in the right spot. So there's a variable amount of response that patients have to hip injections. Some people only have a couple of weeks, but some people have 6 to 12 months of relief. And that's certainly more the goal. And some people even have multiple years of relief. And there's no way, unfortunately, with our current medical literature, we can't pinpoint who's going to benefit and who's not, based on weight or age or gender. We just don't have that kind of data. But in terms of you trying a therapy at the oral medicines, and you've tried to lose as much weight as possible, and you've been active, then certainly a steroid injection is a great first step. A PRP injection is an acronym for platelet-rich plasma. And with the steroid injection, we have that medicine in the counter, and we can put it in a syringe and put it in your joint. But with PRP, we draw your blood through a simple needle stick, and then we spin it down through a centrifuge machine that gives us the healing factors out of your blood, essentially. And we inject those healing factors into your hip joint. And again, the medical literature is not what I call it's not a slam dunk, so it's not a fail-safe option, but it's certainly a good non-operative option if you really want to avoid surgery and the steroid injections just haven't done it for you. And then I'm sorry I left this off the slide, but there's one more that's called a visco supplement injection, and that's we get it in nature from the comb of a rooster. And it just provides more gel. We call them gel shots, and it provides more of the natural lubricating, restores the natural lubricating function of your hip joint fluid. So certainly talking about those things can be beneficial. Now, I do want to point out that there's lacking evidence in the medical literature, and I know the TV screams at you alternatively because people want to make money off of you. But things like glucosamine or chondroitin pills, and you might have to look at the bottle to see if it has this in it, but it's called glucosamine, chondroitin, and the brand names for these are like Osteo, Bioflex, things like that. The medical literature just does not support those. It's about as good as taking a sugar pill. So if you have money to burn and you just want to try it and see if you get something out of it, that's fine. You shouldn't hurt yourself with it, so that's fine. But if that were my money, I wouldn't spend it on it. And last but not least, opioids, the heavy pain-killing medicines. A large randomized controlled trial, which is the best form of study design we have in medicine, of over 240 patients, found that patients with chronic, so ongoing more than 3 months, so years or so, back pain, hip pain, or knee pain who took opioids had no better control of their pain compared to these therapies we just talked about up here. Okay, so and certainly in our country today, whether it's because of the abuse of certain patients in the United States of this medicine, I can't exactly pinpoint, but we do know that opioids have serious side effects, right? So they can make you stop breathing and stuff like that. So, but good news that it doesn't necessarily improve your pain any better than all of these therapies we do up here to get your hip better. And then last but not least, when all else fails, we still have really great treatments, and that being a replacement of your hip joint. And the way they do that is just, take out the part of the bone that's diseased and put in metal implants with certain other lubricating structures that helps you move. And patients usually have really great quality of life after this intervention. Again, it's a serious, treatment. So there's a lot of risk involved in terms of getting, like if you have any heart disease or pulmonary disease, meaning lung disease, it can be a serious risk-benefit kind of decision to make. And most of our surgeons here won't operate if your BMI is greater than 40. Okay, so it's not that they're trying to be mean, but they just have evidence that patients don't do as good if that BMI is higher. And then total hip replacement usually has excellent short and long-term outcomes. So, and then who really qualifies for this? Well, again, it's patients who have tried all of the prior therapies, just like we talked about. So with all of these, staying active, weight loss, Tylenol, considering NSAIDs, steroid, visco supplement, gel shots, and PRP injections. When you fail all those, then it's certainly a conversation to be had. And when your x-ray shows bone-on-bone kind of disease. So with that, I hope I haven't bored you too much, but just want to open it up for questions.